I would like to share with you today the process of having TPS at our clinic as a treatment for mild to moderate Alzheimer's. So this is our TPS machine. But before jumping and discussing the machine or describing the machine and the treatment, we would like to make it clear that before patients are prescribed TPS as a treatment for Alzheimer, they will need to see one of our old age psychiatrists, and the old age psychiatrist will run a memory assessment to be able to confirm that they have mild or moderate Alzheimer that might respond to TPS, and to make sure that they don't have any of the contraindication that would stop them from having TPS. After this assessment, if the patient had an MRI scan done already, that's well and good. If not, we usually arrange for them to have an MRI scan, and this is for a very good point. This machine is quite sophisticated. We've got here this camera, which is a neuro navigation device. So we need to upload the MRI of every specific patient to the machine. So we treat very specific areas of the brain using this probe here. The patient will then, after we get the MRI scan, we're going to upload it. I'm a neuromodulation specialist. We're going to define or find and locate certain parts of the brain. We usually stimulate the frontal lobes, the parietal lobes, and an area called the precuneus. Sometimes also we stimulate the temporal lobes, and I'm going to show you this in a second. And then the patient would come. The session usually takes 50 minutes, and the course of treatment is 6 sessions over 2 weeks. The patient, they are more than welcome to come with someone with them. There's nothing specific that the patients need to do before or after the treatment. There's no medication involved in this. The patient should not be sedated. We do not give them any medication, and they can resume their usual life activities straight away after the sessions. The side effects of TPS, any treatment comes with side effects, and I usually say if there is a treatment without side effects, you start wondering if it's really doing something. The side effects of TPS is quite minimal. It's a very well tolerated treatment. Most patients will not experience any noticeable side effects, but you can have very little swelling at the site where we are stimulating. You might have only also some sensation that some patients might describe as pain, and this is during the sessions. Some patients might get a little bit of headache. The side effects and the contraindication, it's an essential part of our consent form. So the patient will come, we're gonna upload the MRI on the machine. Let's imagine that this dummy head is the head of the patient. The patient will be wearing something like these goggles here, and we'll attach this to it. Why do we do this? So this camera here, the neuro navigation device, can detect where this is and identify parts of the brain that we're gonna be stimulating. Just to make it clear, this camera does not film you. It only detects this device attached over your nose. And then the patient will be sitting in front of the machine. Of course, we put the protocol on, and then we start stimulating. The stimulation sounds like this. I'll put it over my head, so as you can see, it's not painful. And you stimulate, you know the number of pulses that need to be delivered in every part of the brain. So we'll be stimulating different parts of the brain. Of course, it's a little bit clumsy because I'm holding it. We'll be supporting the patient head while we're delivering this treatment. The treatment itself takes about 50 minutes. We might, for some patients, need to put some gel to ensure that the stimulation is reaching the parts of the brain we're stimulating.